there he is, Dr. Nebblett. Can you hear me okay?
I surely can.
Wonderful, and we can hear you. Let's give him a nice warm welcome coming from New Mexico. We're just delighted to have you here, and we tried to do it last night, but there were some technical difficulties, but here you are, and you look just as good as you did last night when we were debriefing and so forth. So tell us a little bit about yourself, Dr. Nebblett.
Certainly. I am a family physician. I've been so for over 25 years, and I've had the privilege of working in a variety of situations. I'm a graduate of Loma Linda University, and then from there, I went to do my residency in Chicago at the Hinsdale Hospital, and I taught there for 15 years, and then on to Michigan, and now in New Mexico for the past 13 years.
Wow, ending up from Chicago to New Mexico, and actually you're visiting us here in Canada, here in British Columbia. Everybody say, yeah. Yeah. All right, so, okay, so what's your topic? What would you like to talk about tonight, Dr. Nebblett?
Well, I want to talk about something that is readily available to all of us, and you got a good dose of it today, I understand.
That's right.
Something that you would think we would take advantage of, but some people are very concerned about it, and that is sunshine.
Sunshine.
Something that we all need.
Excellent. Everybody shout out sunshine. I mean, it makes the news when it comes here, right? But, okay, so are we getting enough sunshine?
Well, you know, it's very interesting. There are a lot of people who are very concerned about getting too much sunshine, and it is true that you can overdo even a good thing. The fact of the matter, however, is that we altogether probably get less of it than we need. Even here in New Mexico, where we tend to get sunshine 360 out of 365 days, even so, I have many patients who are not taking full advantage of what sunshine has to offer.
Wow, that's quite a contrast. How many days do you get sunshine? No, we won't go there. Don't worry about it. Don't worry about it. And anyway, I got to be nice. I'm up here in Canada, and I better not take anything for granted because I just barely crossed the border. But anyway, okay, so tell us a little bit more about sunshine and how much do we need and why we need it and what if we don't get enough?
Well, it's a particular challenge, particularly for those people who live above the 35th parallel. You know, if you ever have a GPS or you look at a map, you can see these lines going across the map that sort of map out just where we are in relationship to the equator. Well, it turns out that those individuals, like those who are living there in Canada, who live above the 35th parallel, have a particular challenge because sunshine is what allows our bodies to make vitamin D. It actually makes it from cholesterol that is in all of our bodies. And our cholesterol is turned into a vitamin D, and this vitamin D is essential for many, many things that go on in our body every day. And there are a lot of people who are so concerned about this that they're trying to protect themselves because they don't want to get skin cancer. And that is appropriate. However, to avoid it entirely is to create another set of problems. And there have been a lot of interesting studies that have pointed out the challenges of individuals who have low vitamin D.
Okay, so what happens then if we are low in vitamin D? I mean, how does that manifest itself? What are the symptoms?
Well, the thing that is most interesting is that, first of all, you have to be aware that there are those who are of different ethnicities. The color of their skin matters a great deal. If your skin is darker, you're going to need more exposure to sunshine in order to make adequate amount of vitamin D. And if you are very fair-skinned, red here, for example, you're going to need less exposure to the sun. So it's going to vary according to the person and their skin type. But that being said, the thing that we ought to do if we are wise is to find out just exactly what our need is. The simplest way to do that is to go to your doctor and have your doctor check a vitamin D level. Your doctor ought to know what is the correct vitamin D test to run. It's 25 hydroxy or OH. And so this is what we test our patients all over. And that gives you an idea of where you need to be. Now, I'll tell you that those of darker skin tend to, unfortunately, especially if they're like me, and I'll use my case as an example. I see patients all day long, and during the time when I should be getting some sun exposure, I am not. because I'm indoors taking care of people. Many people are working in offices, they're doing indoor jobs, and as a result, they're not getting quite the exposure that they need. So when I checked my vitamin D level, it was 12. Now, I have to tell you, that is not good.
Wow. Well, thanks.
Now, a normal vitamin D level is 30 nanograms per milliliter. You don't care, just 30 to 100. Over 100 is considered to be too much. The ideal is 60. That's what I tell my patients. Now, a lot of doctors disagree with this, but I've looked at a lot of the literature, and it was a very interesting study, what I can tell you about briefly if you have the time.
Yes, tell us. Go ahead.
Okay. They did a study several years ago, and they studied about 9,400 people, doesn't matter, but 78% of these people were women. The average age was 57. When they checked the vitamin D levels, their average level was 19. Well, they looked at their risk over the next 1.5 years, and they were looking to see what sort of diseases showed up with those who had low levels of vitamin D and those who had high. Now, there are some that are pretty obvious, like softening of the bones, osteoporosis. But what was interesting, and that is one of the very definite manifestations of an individual whose vitamin D levels are too low, their bones are softer, they're more likely to have a fracture. But they found out very interestingly that those who had higher levels of vitamin D, even as high as 44, these individuals had lower levels of coronary artery disease, heart attacks, strokes. Imagine that. You're like, what does that have to do with anything?
Wow.
Well, it turns out vitamin D is involved in many mechanisms in the body.
So vitamin D for dynamite for the body, or dynamic. So, okay, so we need enough vitamin D. So you're recommending, number one, we go to our doctor, we get a blood test. There is a diagnostic test. It has good accuracy, does it? And it'll help us to know our level?
Exactly. That's the simplest way to know. There are many patients who think that their levels are adequate. I invite you to find out. The other thing is that when you are faced with where you live, this is going to matter. When you're above the 35th parallel, it's a particular challenge, no matter what time of the day you go out or how long you stay out, to get adequate amount of vitamin D that will convert your cholesterol into vitamin D. So getting enough sunshine. So for these individuals, I recommend that they consider supplementing vitamin D. I don't usually recommend supplements across the board, but vitamin D is one of them that I do.
So vitamin D is a unique exception that Dr. Nebblett would recommend. So I'm just curious, on a closing note, how's your vitamin D level?
Well, I've had to take vitamin D in order to get my level up. I've gotten it up as high as 25, so I've at least doubled it. But I need to be more faithful, to be honest with you, in taking my vitamin D and taking every opportunity, because I'm fortunate to live below the 35th parallel, to get outside when there is some sunshine, spend 20 minutes, and get my vitamin D levels elevated.
Amen.
It helps everyone.
That's great, but at least it's doubled. You're on the right track there. You're progressing. And so, listen, we want to have you back. I don't know if you can make it tomorrow night, but we'll talk about that. But we definitely want to have you back here at the seminar that we're doing here in Canada. Thank you so much, Dr. Nebblett, for joining us. We really appreciate it. God bless.